Well, I, of course, have two children who are in elementary school, and so this is an issue that's top of mind in our households and our neighborhoods across the country. And, of course, we know and we heard, I think a lot of us are comparing what we knew then, what we were told then versus now, and sort of making educated guesses based on what we're hearing and filtering. But there's still that notion of under 5 population still has not been vaccinated, and you do see the rates of people being infected even when they're vaccinated. I agree, of course, you do have the embarrassment of 3 riches in the form of vaccines. So how do people go about assessing what their risk tolerance ought to be? Because even that can be a cause for concern of, well, am I being an irresponsible parent if I don't have a mask on my kid, even if they're vaccinated? Is there peer pressure of society or the schools? How do I go about assessing my own views of risk?
Right. It's really, really complicated, and this is what I spend time doing with my patients every day, is sort of marrying the broad public health advice with evidence and then the patient's unique medical vulnerabilities. Let me say this. So I hear people who have kids under 5 who are unvaccinated. Those kids have not yet had the benefit of the vaccine. At the same time, the under 5-year-olds are generally at very low risk for poor outcomes. The under 6-month kids are at a little bit higher risk, but those kids can be protected if they're lucky enough to be breastfed by antibodies transferred from the mother through breast milk. For people who are worried about whether their child is going to spread to teachers, for example, because we all want to care for our communities, I would remind people that the data are clear that kids tend to spread the virus less than adults. Kids have been assumed to be these vectors of disease when actually they transmit the virus less. And then when they've been vaccinated, while the vaccine doesn't eliminate the risk of transmission, it reduces it somewhat. Moreover, we don't have good, clear, real-world evidence that masking kids in schools has a meaningful effect on transmission of the virus. And so when you have an intervention like a mask, it's not appropriate to mandate it when the benefits are clear and the harms are non-zero.